Professor Moore. This is Alison Derois, and I'm doing my informative speech. I'm here to introduce my 7 members of my audience. Okay, this is Joe. He's going to be the cameraman, but he'll be here in the room. This is Ross. This is Jerry. This is Jackie. This is my mom, Sue, with my dog Paisley and Chili. This is Karen, and that's my stepdad, Rick. Okay. What are you? All right. According to the National Institute on Drug Abuse, tobacco is the leading preventable cause of disease, disability, and death in the United States. Between 1964 and 2004, cigarette smoking caused an estimated 12 million deaths, including 4.1 million deaths from cancer and 5.5 million deaths from cardiovascular diseases. Believe it or not, tobacco was considered to have incredible healing powers. American Indians and Europeans thought tobacco could kill even the deadliest disease, cancer, and boy were they wrong. It wasn't until 1610 that Sir Francis Bacon realized some of the dangerous effects of smoking tobacco. He found it rather difficult to quit. In 1826, the raw form of nicotine was discovered, and soon after it was found to be a dangerous poison, an insecticide. Unfortunately, it wasn't until the 1960s that health hazards from ingesting tobacco were reported. Some of these risks include lung disease, cardiovascular disease, secondhand smoke, and many types of cancer. I'm here today to inform you what these diseases are and how they can affect your body. First on the list is what cigarettes are mainly known for causing, lung disease. According to the American Lung Association, more than 35 million Americans suffer from a form of lung disease. The two most common types of lung disease are chronic bronchitis and emphysema, together known as chronic obstructive pulmonary disease. And this is a picture of a normal lung, and this is a picture of a lung infected by some type of lung disease. Chronic bronchitis is caused by cigarette smoke irritating the airways of your lungs, causing mucus to be produced. When this mucus is produced, it makes it difficult for a person to get air into their lungs. Chronic bronchitis is usually detected by a phlegm-producing cough and shortness of breath. If this inflammation is not treated for long periods of time, it can lead to permanent damage of your bronchial tubes. These tubes become scarred, causing mass quantities of mucus to be produced, making your lungs an ideal breeding ground for infections. Most people mistake this disease as non-life-threatening, but if gone untreated, chronic bronchitis can and will lead to heart failure or serious respiratory problems. This is a picture of chronic bronchitis, and this is your bronchial. This is a normal bronchial, and this is your infected bronchial with the mucus inside. Chronic bronchitis affects all ages, but mostly occurs in people over 45 years. And women are 2 times more likely to develop chronic bronchitis than men. According to the American Lung Association, in 2002, 2.9 million males were diagnosed with chronic bronchitis, compared to 6.2 million females. Emphysema occurs when the walls between the air sacs within the lung lose their ability to stretch and recoil. These air sacs are destroyed when the oxygen in your blood is replaced with carbon dioxide. When this happens, irreversible damage occurs. Holes are created in the tissue of your lower lung, making it harder for your lung to put oxygen back in your bloodstream, causing shortness of breath. Also, lungs lose their ability to expand, and this is important to keep your airways open. And this is a picture of emphysema. Here's your normal air sacs, and here's your infected air sacs. They're swollen. And then this is also a physical picture of what your lung looks like with emphysema. Over 3.1 million Americans have been diagnosed with emphysema, of which 91% were 45 years of age or older. Emphysema rarely occurs in those under 45, and men tend to have higher rates of emphysema. In 2002, the emphysema prevalence rate was 52% higher in males compared to females. As you can see, chronic bronchitis and emphysema are life-threatening, but fortunately can be treated. The number 1 recommendation is to stop smoking. Antibiotics are also available, but they have to be taken constantly. And then there are the painful surgeries like lung transplant or lung volume reduction surgery. You take your pick. Does anyone know what the #1 disease of smoking-related deaths is? If you thought it was one of the 2 lung diseases I spoke about, you're wrong. Chronic bronchitis and emphysema do kill a lot of smokers, but heart disease holds the top spot on the list. About every 33 seconds, one person dies from cardiovascular disease. This approximately is 2,600 people a day. When people smoke, it increases their blood pressure, decreases their ability to exercise, and increases the tendency for their blood to clot. With this mixture of issues, you're just asking for a heart attack or stroke, which happen to be the 2 most common cardiovascular diseases. Heart attacks are created when nicotine in cigarettes cause blood pressure to increase, making your heart work harder than it needs to. When this occurs, oxygen in your blood is replaced with carbon dioxide. Nicotine in a cigarette smoke also decreases the amount of good cholesterol, which allows fat to be deposited on the walls of your arteries. These fatty deposits from plaque, which is hard on the outside of your artery and soft on the inside. When the plaque is hard, it ruptures, causing platelets to come to the area and clot your blood. This blood clots your artery and starves your heart of oxygen. Soon heart tissue dies and you just had a heart attack. And here's a picture of a heart attack. This is your clotted artery. A person's risk of heart attack greatly increases with the number of cigarettes he or she smokes. Smokers continue to increase their risk of heart attack the longer they smoke as well. According to the American Heart Association, people who smoke a pack of cigarettes a day have more than twice the risk of a heart attack than non-smokers. Women who smoke and also take birth control pills increase several times their risk of heart attack and stroke. There are 2 forms of stroke, ischemic and hemorrhagic. An ischemic stroke is directly related to smoking and is caused by a blood clot that blocks the blood flow to your brain. Do you have any idea where those blood clots come from? If the blood that was clotted around the plaque in your arteries doesn't cause a heart attack, it has a chance of traveling to your brain and cutting off blood flow. Within minutes, brain tissue begins to die and permanent damage will be done. The area of tissue that was damaged will not be able to function properly, causing your body not to function properly. The U.S. incidence of stroke is estimated at 600,000 cases per year, and the 1-year fatality rate is 30%. And here's a picture of an ischemic stroke. Here's the blood clot right here, and here's the area of your brain that is not getting any blood flow. Okay. Yet again, heart attacks and strokes are no joking matter. The best recommendation is stop smoking and know the signs and symptoms of a heart attack and stroke. Knowing these will increase your chances of preventing devastating damage. Secondhand smoke is also known as passive smoke or environmental tobacco smoke. Believe it or not, secondhand smoke can also cause chronic bronchitis. And the Environmental Protection Agency, EPA, has classified secondhand smoke as a known cause of cancer in humans. Each year, approximately 3,000 non-smokers die of lung cancer from secondhand smoke. Is it really worth the risk when you know who else is being harmed? There are a number of complications related with smoking. Lung disease, cardiovascular disease, and secondhand smoke are just a few. But no matter what the smoking-related disease is, it will hurt your life, or will put your life at risk along with the others around you. Smoking can kill you. Smoking is the leading preventable cause of death in the United States. More than 440,000 Americans die from tobacco-related causes each year.